Welcome back. Today we're covering 3 progressive calf strengthening exercises that can help improve lower leg strength, circulation, and balance after 60. These movements target your calf muscles, primarily the gastrocnemius and soleus, which play important roles in walking, standing, and maintaining balance. They also assist in venous return, helping pump blood from your lower legs back toward your heart. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises. Understanding lower leg muscle function. Your calf muscles consist primarily of 2 main muscles, the gastrocnemius, the larger, more visible calf muscle that crosses both your ankle and knee joints, and the soleus, a deeper muscle that lies underneath, crossing only the ankle joint. Both muscles work together when you walk, stand, or rise onto your toes. However, they can be targeted differently based on knee position. With the knee straight, both muscles work together. With the knee bent, the soleus does most of the work, as the gastrocnemius becomes less mechanically effective. The soleus is sometimes informally called a second heart, because its rhythmic contractions during walking and movement help pump venous blood upward against gravity. This is part of your body's venous return system. However, it's important to understand this is one component of circulation among many, not a replacement for cardiovascular exercise or medical treatment for circulation problems. As we age, these muscles can weaken from reduced use, contributing to reduced ankle strength, decreased walking efficiency, balance difficulties, and slower venous return from the lower legs. The 3 exercises we'll cover today progressively challenge these muscles, starting from a safe seated position and advancing to more challenging standing variations. Exercise 1, Seated Calf Raises. The first exercise is the seated calf raise, which activates your calf muscles in a supported, low-risk position. This is an excellent starting point because it allows you to work these muscles without the balance demands of standing, provides external support through sitting, and permits you to focus on the muscle contraction without other concerns. Here's how to perform seated calf raises. Sit in a sturdy chair with your feet flat on the floor. Your knees should be bent at approximately 90 degrees. You can place your hands on your thighs or hold light weights on your knees if you want added resistance, but this is optional. Keep the balls of your feet pressed firmly to the floor throughout. Slowly lift both heels as high as you comfortably can, rising onto the balls of your feet. You should feel your calf muscles contracting. Pause briefly at the top position, 1 to 2 seconds. Then slowly lower your heels back to the floor with control. That's 1 repetition. Perform 10 to 15 repetitions. Rest for 30 to 60 seconds, then repeat for a second set if comfortable. You can practice this once or twice daily. Key points: move with control, not momentum. Focus on the full range of motion, lifting as high as comfortable, lowering completely. And breathe naturally throughout, don't hold your breath. What this exercise does, it activates both calf muscles, particularly emphasizing the soleus in this knee bent position. It encourages blood flow from your lower legs. And it begins building the neuromuscular connection between your brain and these muscles, essentially reminding your nervous system how to activate them effectively. Safety considerations: this exercise is generally very safe. However, consult your healthcare provider first if you have recent or active deep vein thrombosis, severe varicose veins with pain, or any unexplained calf pain or swelling. What to realistically expect: with regular practice over several weeks, you may notice it feels easier to rise onto your toes, reduced heaviness in your lower legs by end of day, and improved awareness of these muscles during walking. What you should not expect: dramatic circulation improvements. This complements but doesn't replace walking or medical treatment for circulation issues. Complete elimination of leg swelling. Many factors contribute to this. Or rapid strength gains. Muscle building takes consistent practice over weeks and months. Exercise 2, Standing Calf Raises. Once you're comfortable with the seated version, standing calf raises add the challenge of supporting your full body weight and engaging your balance systems. This progression is valuable because it's more functional, similar to actually walking and standing on your toes, and it increases the resistance on your muscles, leading to greater strengthening potential. Here's how to perform standing calf raises safely. Stand facing a sturdy surface like a kitchen counter, heavy table, or stable chair back. Place both hands on this surface for balance support. Use as much or as little support as you need to feel stable. Position your feet hip-width apart with toes pointing forward. Distribute your weight evenly through both feet. Slowly lift both heels off the ground, rising onto the balls of your feet. Rise as high as you comfortably can. You should feel your calf muscles working to lift your body weight. Pause briefly at the top, 1 to 2 seconds. Then slowly lower your heels back to the floor with control, maintaining balance throughout. That's 1 repetition. Perform 10 to 15 repetitions. Rest for 60 to 90 seconds. Complete 2 to 3 sets. Practice this exercise twice daily if desired. Many people find morning and evening works well. Key points: maintain contact with your support surface throughout. This isn't about removing support, it's about safely strengthening. Keep your ankles, knees, and hips aligned. Don't let your ankles roll inward or outward. Move through the full range, lift as high as comfortable, lower completely to the floor. And control the lowering phase. This eccentric portion builds significant strength. What this exercise does, it strengthens both gastrocnemius and soleus muscles under load. It trains ankle stability and proprioception, your body's sense of its position in space. It challenges your balance systems in a controlled way. And it mimics the demands of actual standing and walking. Safety considerations: avoid or modify this exercise if you recently had foot, ankle, or lower leg surgery, experience dizziness when standing, or have significant balance impairment without adequate support nearby. If you have concerns, continue with the seated version and consult a physical therapist about progression. What to realistically expect: with consistent practice over 4 to 8 weeks, standing tasks may feel more stable. You'll likely notice increased calf muscle firmness, ankle strength during walking may improve, and confidence in balance during standing may increase. What you should not expect: dramatic visible muscle growth. At this age, functional strength matters more than size. Complete elimination of balance issues. Balance is multifactorial. Or rapid transformation. Strength building is gradual. Exercise 3, bent knee calf raise, single leg option. The third exercise is an advanced variation that specifically targets the soleus muscle through bent knee positioning and optionally adds single leg challenge for greater difficulty. This exercise is valuable because the bent knee position preferentially activates the soleus, which is crucial for ankle stability and endurance activities. And the single leg option significantly increases strength demands and balance challenge. Here's how to perform this exercise. Stand behind a sturdy chair or counter, holding on for balance support. For the double leg version, keep both feet on the ground. For single leg, shift your weight onto one leg and lift the other foot slightly off the floor. Now, here's the key: slightly bend your standing knee or both knees. This isn't a deep knee bend, just a soft, athletic flexion of approximately 10 to 20 degrees. Maintain this knee bend throughout the exercise. From this bent knee position, slowly lift your heel or heels off the ground as high as you comfortably can. You should feel activation deeper in your lower leg, closer to your ankle, compared to the straight leg version. Pause briefly at the top. Then slowly lower your heel back to the floor with control. That's 1 repetition. For double leg bent knee version, perform 10 to 15 repetitions, 2 to 3 sets. For single leg version, perform 8 to 12 repetitions per leg, 2 to 3 sets per leg. Key points: the knee bend is essential, it shifts the work from gastrocnemius to soleus. Keep the knee bend consistent throughout all repetitions. For single leg version, use as much hand support as needed for safety. And progress gradually, master the double leg version before attempting single leg. What this exercise does, it specifically strengthens the soleus muscle, which is critical for prolonged standing and walking. It challenges ankle stability in a knee-flexed position similar to mid-stance during walking. The single-leg version significantly increases proprioceptive demands. And it builds deeper, more endurance-oriented strength in your lower leg. Why the soleus matters: this muscle has a high percentage of slow-twitch muscle fibers, making it fatigue-resistant and ideal for sustained activities like standing and walking. It plays a crucial role in ankle stability during weight-bearing. And it contributes significantly to venous return from the lower legs. However, it's important to note, while strengthening this muscle is valuable, it's one component of overall lower leg and balance function. It doesn't replace cardiovascular exercise, balance-specific training, or medical treatment for circulation or balance disorders. Safety considerations: this is the most challenging variation. Avoid or significantly modify if you have severe balance impairment, cannot stand on one foot even with support, recent Achilles tendon or ankle surgery, or sharp pain when bending the knee under load. If attempting single-leg version, ensure you have very stable support available and consider having someone nearby initially. What to realistically expect: with practice over 8 to 12 weeks, single-leg standing tasks like putting on shoes may feel easier, ankle stability during walking may improve, and deeper lower leg strength and endurance may increase. What you should not expect: this exercise to completely prevent falls. Fall prevention is multifactorial. Dramatic balance transformation: balance training is complex and ongoing. Or that this exercise is necessary for everyone: many people maintain excellent function with just the first 2 exercises. Creating a progressive routine. Here's how to incorporate these exercises into a simple routine based on your current capability. If you're starting with limited lower leg strength or balance concerns, focus on exercise 1, seated calf raises, exclusively for 2 to 4 weeks. Perform 10 to 15 repetitions, 2 sets, twice daily. Once this feels comfortable and controlled, consider progressing. If you have moderate strength and balance, begin with exercise 1 for 1 to 2 weeks, then add exercise 2, standing calf raises. Perform both exercises, seated calf raises as a warm-up, then standing calf raises for your main work. 2 to 3 times per week with rest days between. If you have good strength and balance and want additional challenge, incorporate all 3 exercises in a single session: exercise 1 as warm-up, exercise 2 as main work, exercise 3, bent knee, as advanced work. 2 to 3 times per week. Important principles: progress gradually, don't rush to harder variations. Quality over quantity: perfect form with fewer reps beats poor form with many. Rest between sessions: muscles need recovery time to adapt and strengthen. And be patient: strength building takes weeks and months, not days. Additional supportive practices. These exercises provide muscle stimulus, but several other factors support lower leg health and circulation. Regular walking remains one of the best overall exercises for lower leg circulation, cardiovascular health, and functional mobility. These calf exercises complement walking, they don't replace it. Leg elevation: if you experience lower leg swelling, elevating your legs above heart level for 15 to 20 minutes once or twice daily can help reduce fluid accumulation. Proper footwear: supportive shoes with good arch support and cushioning can reduce lower leg fatigue during standing and walking. Adequate hydration: proper fluid intake supports blood volume and circulation. Movement throughout the day: avoid prolonged static standing or sitting. Regular movement, even just shifting weight or taking short walks, helps activate the muscle pump mechanism. Important limitations: these exercises are valuable tools, but they have important limitations. They don't replace medical treatment for circulation disorders like peripheral artery disease or chronic venous insufficiency. They don't guarantee prevention of falls. Balance is multifactorial, involving vision, vestibular function, medications, and environmental factors. They're not appropriate for everyone without modification. Individual assessment is important. And they complement but don't replace comprehensive exercise including cardiovascular activity and balance training. When to seek professional help. Consult a physical therapist or healthcare provider if you experience sharp or worsening pain during these exercises, significant swelling that doesn't improve with elevation and movement, balance difficulties that prevent safe exercise performance, or uncertainty about whether these exercises are appropriate for your situation. A physical therapist can assess your individual needs and provide personalized modifications or alternative exercises. Realistic timeline and expectations. Strength and function improvements are gradual. Here's what's realistic: weeks 1 to 3, you're learning movement patterns, possibly experiencing mild muscle soreness, normal, building neuromuscular connections. Weeks 4 to 8, movements feel more natural and controlled, you may notice some functional improvements like easier toe raises, and possible mild strength increases. Months 3 to 6, continued gradual strengthening, maintenance of gains with ongoing practice, possibly reaching your individual strength plateau, which is appropriate. The goal isn't endless progression, it's reaching and maintaining a functional strength level that supports your desired activities. The broader context. These calf strengthening exercises are valuable components of healthy aging, but they exist within a broader context of comprehensive health, including regular cardiovascular activity like walking, balance and flexibility training, strength training for other muscle groups, social connection and mental engagement, adequate nutrition and sleep, and regular healthcare and medical management. These exercises are tools, effective tools, but not complete solutions. They work best as part of a comprehensive approach to maintaining mobility and independence. Thank you for watching. The key takeaway: progressive calf strengthening through exercises like seated calf raises, standing calf raises, and bent knee variations can help maintain lower leg strength, support ankle stability, and contribute to venous return when performed consistently and safely. These aren't miracle movements, but they are practical, accessible exercises that support the lower leg strength important for walking, standing, and balance. The soleus muscle does assist in venous return, but calling it a second heart is dramatic language. It's one valuable component of your circulatory system, not a magical solution. Walking remains an excellent, essential exercise for overall health. These exercises complement walking. They add targeted lower leg strengthening that walking alone may not fully provide. But they don't replace the cardiovascular, mental health, and overall mobility benefits of regular walking. If you have specific concerns about lower leg strength, circulation, or balance, consult with a physical therapist or healthcare provider for individualized assessment and guidance. Consider subscribing for evidence-based movement guidance that respects both the science and your intelligence. No hype, no false promises, just practical information. Lower leg strength after 60 is achievable and valuable. It requires consistent practice, realistic expectations, and integration into a broader healthy aging approach. Take care of your body with thoughtful, informed choices.